The role of exercise in the prevention and management of chronic health conditions. Introduction. The role of exercise in preventing chronic health diseases. Current research has found irrefutable evidence that regular physical activity is effective in the primary and secondary prevention of several chronic health diseases such as osteoporosis, diabetes, hypertension, cardiovascular disease, depression, and cancer. Regular exercise helps reduce the risk of chronic diseases caused by sedentary lifestyle and poor eating habits, as well as other lifestyle choices linked to poor health, such as smoking and overconsumption of alcohol. Regular exercise results in a number of positive biological effects on your body that help improve heart, lung, muscle, bone, and joint function. In order to best improve overall health and reduce disease risk, regular exercise should be combined with good nutrition. Cause of chronic health diseases. Whenever discussing exercise as a prevention or management for chronic health, it is important to understand the cause of chronic disease to begin with. Diet and nutrition is the most important factor in preventing chronic disease. This is because poor nutrition and diet is the major cause of many chronic diseases, such as cardiovascular diseases, diabetes, and hypertension. Sedentary lifestyle is also a major cause of chronic health problems. Because of ongoing inactivity, our body no longer has to meet the energy and biological demands required to function at a more active level. Because of this decrease in function, the body does not maintain processes as efficiently, thus increasing the risk of disease. The effect of sarcopenia. Sarcopenia is the age-related loss of muscle mass which reduces strength, functional independence, and overall quality of life. It is characterized by changes in muscle morphology, protein, and hormonal kinetics, oxidative stress, inflammation, physical activity, and nutrition. Even if an individual maintains a healthy and nutritious diet, they still face the inevitable effect of sarcopenia, which is caused simply by aging. However, exercise such as resistance training has been shown to slow down the effects of sarcopenia because resistant exercise helps increase and maintain muscle mass and strength. A sedentary lifestyle, on the other hand, will likely increase the rate of sarcopenia as well as increase the risk of chronic diseases. Osteoporosis. The combination of age-related sarcopenia, the reduction of type 2 fast-twitch fibers, and decline of physical activity can affect an individual's mobility and increase the development of bone fragility and increase the risk of falls. Osteoporosis is when bones lose their strength and density, become fragile, weak, and brittle, and can fracture more easily. Adults who do not perform regular resistance training lose approximately 0.46 kilograms of muscle yearly from the 5th decade on. Furthermore, adults who do not perform resistance training experience a 50% reduction in type 2 muscle fibers, the fibers responsible for levels of strength, by the age of 80. Resistance training has profound beneficial effects on the body by maintaining functional abilities such as maintaining skeletal muscle mass and bone density. By maintaining muscle mass and bone density, this helps prevent the onset of osteoporosis, sarcopenia, and with that, accompanying falls, fractures, and disabilities. Exercise that specifically aims to maintain posture and train back muscles helps reduce the risk of axial deformities such as kyphosis, as vertebral fractures are common in osteoporosis and can highly limit an individual's ability to stay active. Metabolic syndrome. Metabolic syndrome is a collection of risk factors where a person has 3 or more of the following: hypertension, high blood triglycerides, low levels of high-density lipoproteins, and/or high level of low-density lipoproteins, obesity, especially excess fat in and around the stomach, and impaired fasting glucose or impaired glucose tolerance. Diabetes. When an individual has metabolic syndrome, they are at high risk of developing type 2 diabetes. Diabetes is diagnosed by fasting blood glutamic acid levels being consistently more than 7.0 millimoles per liter, or random blood glutamic acid levels being more than 11.1 millimoles per liter. Bassick and Mason identify a strong link to diabetes and inactivity, which also coincides with high intake of sugar and a reduced ability to produce large amounts of insulin. A lack of exercise and poor diet often leads to an increased amount of visceral fat, which is linked to an increased risk of chronic disease. Item and Conrad state that visceral fat strongly correlates with hepatic, insulin resistance, and type 2 diabetes. They propose that the liver is directly exposed to increasing amounts of free fatty acids and pro-inflammatory factors released from visceral fat into the portal vein of obese patients, promoting the development of hepatic insulin resistance and liver steatosis. Chudzik and Petrella found that aerobic exercise alone or combined with resistance training improves glycemic control, systolic blood pressure, triglycerides, and waist circumference. Exercise is effective in reducing the risk of or managing type 2 diabetes because when your muscles contract during activity, this stimulates another mechanism which is separate of insulin. This mechanism allows cells to take up glucose and use it for energy, whether insulin is available or not. Regular exercise also increases this uptake of glucose for energy and thus reduces levels of blood glucose and reduces the need for insulin, decreasing the risk of developing diabetes. In a study by Warburton, Nicol, and Brennan, both aerobic and resistant types of exercise were shown to be associated with a decreased risk of type 2 diabetes. It was found in the study that each increase of 500 kilocalories in energy expenditure per week was associated with a decreased incidence of type 2 diabetes of 6%. This benefit was particularly evident among people at high risk of diabetes. This finding has been supported by several other investigations. Hypertension. Hypertension is a chronic condition where the blood pressure in the arteries is elevated to greater than 140/90 millimeters of mercury. Blood pressure is expressed by two measurements, systolic blood pressure and diastolic blood pressure, which are the maximum and minimum blood pressures. Hypertension over time leads to other chronic diseases, such as cardiovascular disease. This is because hypertension causes blood to pump with more force than usual through the arteries. Because of this increase in stress placed on the arteries, damage can be caused in such ways as the clogging of fatty plaques known as arteriosclerosis. Exercise can help prevent and reduce hypertension over time because as the greater demand for oxygen consumption increases with exercise, so does the demand on the heart, which will need to elevate cardiac output, heart rate, and stroke volume. Over time, as a person exercises more regularly, these changes help strengthen cardiac muscle and the circulatory system, reducing systolic blood pressure and diastolic blood pressure. McArdle, Katch, and Katch found that aerobic exercise training in previously sedentary men and women of all ages lowered systolic blood pressure and diastolic blood pressure by 6 to 10 millimeters of mercury. Cardiovascular disease. In Western countries, there is a great incidence of cardiovascular disease that is largely attributed to a lifestyle that is often sedentary and includes a diet high in saturated fat and sugar, and low in omega-3 fatty acids, fruit, vegetables, and fiber. Cardiovascular disease is a collective term for diseases of the heart and blood vessels. In combination with drug treatment, nutrition, and physical activity are the recommended treatments for patients at high risk of cardiovascular disease. Ignaro, Ballestari, and Napoli note that any strategy that can influence health maintenance is of interest, especially lifestyle factors such as nutrition, exercise, and stress control. Regular aerobic exercise, which will help improve blood circulation and the efficiency of oxygen distribution around the body, is an effective treatment and prevention of cardiovascular disease. For those at risk of cardiovascular disease, it is extremely important to first seek medical advice before starting an exercise program. Warburton, Nicol, and Brennan explain that routine physical activity has been shown to improve body composition, enhance lipid lipoprotein profiles, improve glucose homeostasis and insulin sensitivity, reduce blood pressure, reduce systemic inflammation, decrease blood coagulation, improve coronary blood flow, augment cardiac function, and enhance endothelial function. All these improvements, explained by Warburton, Nicol, and Brennan, reduce the effect of cardiovascular diseases as well as other chronic conditions. This is because people faced with chronic disease often have or are at risk at multiple chronic conditions. Wanamathi, Sharper, Whincup, Lennon, and Satar explain that type 2 diabetes is a risk factor for cardiovascular disease, and therefore exercise benefits for diabetes are also benefits for cardiovascular disease, and vice versa. Depression. Exercise is a readily available therapeutic option effective as a first-line treatment for prevention in mild to moderate depression. Exercise and physical activity have beneficial effects on depressive symptoms that are comparable to those of antidepressant treatments. Current research is showing that exercise and physical activity can be used as a therapeutic means for depression in the general population as well as in hypertensive and cardiovascular disease patients. Dinas, Koutadakis, and Flowers explain that this is because endorphins are produced by the pituitary gland and the hypothalamus during strenuous exercise, and they help resemble opiates in their ability to produce a sense of well-being. Exercise is also linked to improving mood, adding to a sense of accomplishment, often has a social impact, and improves physical health, leading to mental improvements too. Cancer. Based on the available literature, it appears that routine physical activity, whether as part of a job or as a leisure activity, is associated with reductions in the incidence of specific cancers, in particular colon and breast cancer. It is likely that physical activity is associated with decreased cancer risk via multiple interrelated biologic pathways that may involve adiposity, sex hormones, insulin resistance, adipokines, and chronic inflammation. Existing cancer patients, approximately 50%, are faced with cancer cachexia, which is a complex disorder characterized by a progressive weight loss with catabolism of adipose tissue and skeletal muscle. Exercise, by virtue of its anti-inflammatory effect, is shown to be effective at counteracting the muscle catabolism by increasing protein synthesis and reducing protein degradation. Based on this, prescribing appropriate exercise has the potential to help cancer patients combat cancer cachexia. In conclusion, there is vast evidence within research literature that exercise has a positive effect in both preventing and treating chronic health conditions. Chronic health conditions are often influenced by lifestyle choices such as poor diet and nutrition, sedentary lifestyle, and cigarette smoking. Exercise helps combat current and past poor lifestyle decisions that put people at risk of developing chronic health diseases. The effects of exercise makes our body adapt and make physiological changes that improve heart, lung, muscle, and joint functions. Improved circulatory functions that come primarily from aerobic exercise help improve cholesterol levels, reduce blood pressure, blood glucose levels, insulin sensitivity, and other functions, which help decrease the risk of chronic diseases such as cardiovascular disease, diabetes, and hypertension. Resistance training helps maintain our functioning of bones and muscles, reduces the effects of sarcopenia, and decrease the risk of osteoporosis. Resistance training also boosts our metabolism, which helps reduce obesity and in turn decreases the risk of cardiovascular disease, diabetes, and hypertension. Exercise is also beneficial in releasing chemical reactions in the body, which help reduce stress and may help reduce depression symptoms and risk. There are also links to the reduced risk of cancer and management of the effects of cancer through exercise. It is recommended that good dietary and nutritional habits, including not smoking and limiting alcohol intake, are combined with exercise as the best way to prevent and manage chronic health diseases. Exercise alone, however, can help prevent or limit the effects of other lifestyle choices.